Broadcasting from the business capital of the world, this is the Podcast Business News Network. Hello, everybody, and welcome back to the show. I am Ross Morasso, and my returning guest today, Dr. Brandon Fuller from Absolute Acupuncture and Stress Relief out of Sarasota, Florida. Welcome back to the show, Dr. Brandon. How you doing?
I'm doing all right. How are you?
Good. Since the first time we spoke, I've been looking at acupuncture a little bit more. And I got to tell you, I was surprised at how it does seem to be moving towards, more of a mainstream medical practice. I know it's existed for thousands of years, but just in terms of us here in America, sometimes we're late adapters on this stuff. What is the current state of acupuncture these days for yourself?
Well, it's gaining quite a lot of popularity. More and more of the population, specifically in the US, is going, I'm tired of medication. I'm tired of taking drugs that make me feel sleepy or they give me these side effects. I want something that's gonna help with my problem, but also not give me all these side effects. And so it's quickly becoming one of the fastest growing forms of medicine, and it's more worldwide at that point, to help people without the use of medical drugs like, Advil or Tylenol or something of that nature.
So I'm sure you have a busy practice. I know we've talked about this before, but how is Blue Cross and United Healthcare feeling about what you do these days and your kindred spirits out there? How's insurance companies looking at this sort of treatment?
That's a great question. It's actually a very popular question among patients, and insurance is actually looking at acupuncture more and more. Now, generally, they only ever treat pain, and often some plans will say, "Well, we're just going to treat back pain and neck pain." But as they're seeing that the individuals who are getting treatment are getting better, they're widening their scope. So now it's arm pain or leg pain or um, abdominal pain. And what's nice is that saying it that way opens it up for patients. Because if you think, okay, let's say menstrual cramps for women, well, that would categorize as abdominal pain, whereas back pain could consist of herniated discs or surgery that didn't quite heal the way the patient wanted, or um, something as simple as I went to pick something up off the floor and threw my back out. So it's very generalized in how they state it, which allows us to help patients a lot more easily.
Okay, so that's got me thinking about a couple things here. So when I work with my primary care physician, and if I'm
Hmm.
interested in acupuncture, right? So a lot of health plans like have referrals, stuff like that. But I don't know if they come directly to you or not. I mean, like it just depends, right? It depends on your state, it depends on your
Right.
plan and your company. So
Yeah.
are you saying then that we should all be working with our primary doctors to basically say, can you categorize this as a direct pain, or like as close as you can to saying like it's almost an injury or something like that? Like, is there language that should be done? And maybe it doesn't even matter, but I mean, should there be language in the course of this setup to get to acupuncture that is important so that your health plans don't reject it?
Um, yes, but I think the best course of action first is call an acupuncturist near you.
Mm.
Make sure that they take different insurance plans, because some acupuncturists might not take Aetna if you have Aetna, or they might not take United Healthcare. So contact an acupuncturist, see which sort of insurance companies they actually take, and then have them verify that your insurance will pay for acupuncture, rather than let me go to my primary care and whatnot. I see that an awful lot, especially with individuals who go, well, I pay for the absolute best insurance plan. And you go, I'm sure you do, but your plan doesn't state that it covers acupuncture. It's not that you pay the most money, it's that your plan doesn't cover it. And so contacting your acupuncturist, they can help guide you to what the next steps might be, whether it's, okay, we need a referral from your primary care first, or hey, let's why don't you just come on in and we'll get you started and I'll tell you all about everything, all the steps we got to go through and this and that.
Yeah, the best is relative, right? I could say mine's the best because it's cheap. I mean, who's to say? It's in the eye of the beholder, right? So, do you find though
Right.
that it's fairly common that at least for certain sorts of ailments that insurance companies are now covering acupuncture more regularly?
Yeah, absolutely. Absolutely. And it's amazing to see that these insurance companies are going, well, yeah, no, if this patient actually gets better, we don't actually have to pay out a lot of money into surgeries and things like that. So we make more money, right? And that's always the name of the game, is people making money. And so insurance companies are going, yeah, we're going to start approving acupuncture. And plans where people used to go, you know what, I have the crappiest plan, are now covering acupuncture. And if your copay is $15, great. And if you've met your deductible, fantastic. And you get 20 to 25 treatments a year. And it could be very, very beneficial for people who might not be able to pay out of pocket.
Right? I mean, 20 sometimes a year. I mean, that's a couple times a month or like a nice series all in together. So inside of that,
Right.
and again, it's always like, I'm not going to keep saying this, but like, I didn't realize everything is different and people are different. But what do you
Right.
find is common when people come in um, needing acupuncture? How long does it take
Yeah.
for relief to start happening? How many sessions or how long after a session? Talk to me. How does that work?
So I have a general rule of thumb, because as we stated, everybody's different, right?
Mm,
My general rule of thumb, if you come in for pain, is we're going to start with twice a week for 5 weeks. Now it can, depending on the severity and things, it can shift and adjust and whatnot, but that's my generalized plan. Just to make sure that you're getting the amount of treatments you need. Um, Normally we'll see a decrease in pain within treatments 5 to 7. Uh, but I've had patients who come in and they've been 8 out of 10, and they do one treatment and they're 2 out of 10 the next time they come in, and they go, this is amazing. How did I
one
not know
treatment.
about this? One treatment. And it's great. It's great ego booster for me, right? Because I go, yeah, I'm a rock star. But it doesn't happen as often as I always hope. So that it's important for people to know it can take up to 10 treatments for, even a 50% decrease in pain. It's not like taking a pill. It's not like going, hey, here's this hydrocodone, and that's just going to mask all the pain and you won't feel anything for 8 hours. It doesn't work like that in the natural medicine world. So it's important for people to know those sorts of things.
And it's of course, and that it brings on its other risk, right? So sure, and look, we've all been there, right? Like I just have to get on with my day. Give me a pill. I need to forget about this. But the thing is, it's like if we're injured, and you don't know that you're in
Yeah,
pain, right? I mean, when that 8 hours is done or whatever, like you're gonna have to pay the piper.
right.
So let's talk about one of the big papas of chronic pain, right? Our backs, whether it's our upper
Yes.
spine all the way into our neck or lower back pain. If you have something truly identifiable, like a slip disc or a small herniation in a disc that's causing you daily grief, but like you can stand up straight, but that's now something physical that you can see, right? Like definitely see
Right.
there. Does acupuncture still work with something like that, or does that underlying problem still need to have to be taken care of, or is it both?
Um, it's kind of it's that balance. So what acupuncture will do is it'll reduce the inflammation in that area.
Mm.
Now, depending on the severity of the injury, will depend on how much relief a patient gets, right? So if that herniation is so severe that it's just compressing the nerves there and it's pain all the time and you can barely move, then yeah, acupuncture is probably going to give you a little bit of relief, but it's not going to take the pain away, and you're going to be on kind of a maintenance until something else gets done.
All right.
Whereas
Go ahead.
if it's just a minor, if it's just a minor herniation, acupuncture will most likely to relieve any sort of pain that you have and help you get on with a daily life regimen, give you more mobility, allow you to do things that you might not have been able to do otherwise, and give you that kind of peace of mind.
You know, it only for me personally, it's like, hey, I would rather not have myself sliced open, right? So anything I can do before that, right? As I always say, surgery is the
Right,
last resort. My mother
right,
is a nurse and used to teach nursing, and she even you would go so far as to say, no surgeries after 50 if you can handle it at all, right? So
right, right.
do you find a lot of people coming to you saying, like, hey, I've just like tried all this other stuff and then, let me try this as well?
Yeah, yeah, I do. I get a lot of that. And I'll even say that I do get referrals from medical doctors when they've hit a point of going, okay, we've done everything we can.
Hmm.
I have a patient now who was going to his urologist for some genital pain, and the doctor went, I've thought of everything, I've tried everything that's in my scope to help you. Why don't you go see an acupuncturist? And we're actually making headway, which is great. The reduction in pain is there. Inflammation is going down. Uh, it's nice to see these changes occurring.
All right, so let's talk about expectations walking through your door, right? So for the two of us listening that don't know, acupuncture involves getting a lot of needles stuck into you. So for some of us at a precursory, right, we're like, hmm, walk me through that. I've heard you say in the past, though, that we need not be as freaked out as our minds might tell us. So what is it like? Is the treatment painful? How long does it take? How many needles are you putting in me? Like, well, walk me through what these things look like. Let's again say I got lower back pain. The pain is uncomfortable, but I don't have some major herniation or anything like that. Like I'm one of your better fits, for
Yeah.
acupuncture. What does that look like?
So it's fairly simple. You come in, you sit on the table for a few minutes. We kind of discuss what makes it better, what makes it worse. We might do some orthopedic evaluations just to rule out any major injuries. And then you lay down on the table, and I proceed by putting needles in. Now the needles are filiform needles, so a lot of people hear the word needle and they think, the big gauge needle that they give you for vaccines and things like that. But filiform needles are about the thickness of a cat's whisker,
Mm.
right? They're not big at all. Most patients don't even feel them. I do have patients that'll fall asleep before I'm even done putting the needles into the body. Once they're in, you get to rest, nap, meditate, whatever you want to do for 30 minutes. You just get to lay there and let the body heal.
So
Yeah,
far being it from having anxiety, it's actually more of a chill out session with you.
right. Yeah, absolutely. Absolutely.
So dealing with
Yeah. And
acupuncture,
so,
which I would attribute to Asian medicine. So staying along this line of thought. But
yeah.
now, we'll see in the coming decades here, they might not get to continue to claim ownership on it. But if I have lower back pain or any pain, my knee or any other place, are the needles
Mhm.
always going directly at that place? I know there's this concept of, whole body, work, or would I be surprised to maybe say like, oh, we'll put some in your shoulder, even though it's your knee that's hurting? I don't know. I'm making something up, right? Like generally, how does that work?
Right. So, yeah, we do use what's called distal points. So if your knee hurts, we might look at your elbow and put a couple in your elbow, or we might put some in your ankles, or We are looking at the whole body, right? Think of it this way. If your ankle hurts and you're walking, knowing that your ankle, your knee, whatever might hurt, you're going to compensate. Your body's going to try and compensate for the injury.
Mm.
And when it does so, it uses different muscles. So we want to make sure that those muscles aren't getting tight and causing pain elsewhere. More often than not, I'll see patients who started out with knee pain and now are coming in with low back pain. And it's because they've compensated for so long and adjusted how they sit, how they walk, and everything, that these muscles that weren't used to getting used are now in spasm, inflamed, and there's a lot of pain surrounding it. So it's something that we always try and take into consideration is, all right, what's the main issue? And let's see how the patient moves. What other body parts have become affected because of this?
So do you find that as people work with you that there is a like larger network now that they need to be staying in touch with? You said, we deal a little bit with, orthopedics and things like that. And so that as people get that pain relief, do we also need to be mindful of paying attention to not just what caused it, right? Like sometimes that could be an injury or stuff, but untraining our body to, right, with muscle memory, right? We kind of get used to walking incorrectly. So is that a component of that? Like after the pain goes away, of like start to unlearn the bad stuff?
Yeah, very much so. I like using the analogy, it's like peeling an onion, especially
Mm.
for those who come in and, they started with knee pain, now it's back pain. And we start to peel that onion, we start to fix that back, and then they go, man, my hip's been really sore today. And you go, okay, we're going backwards to where it started with knee, then it went to hip, now it's in the back, and we're peeling that onion away, getting back to that main problem. And we can do all of this while within treating each other's spot, but it's almost like I said, it's almost like peeling that onion, getting to those deeper layers, getting to that original issue that a patient had.
All right, so this is fascinating then. So, and I think these details matter for a lot of us when we're taking on something new like this, right? And we care about our
Right.
bodies. So, all right,
Yeah.
so I started with my right hip, and then now, oh, I am noticing something on my knee, like as an example. All right, but now my hip pain is much reduced, but I'm noticing this in my knee. In your subsequent treatments, will you continue to do a little bit of work on the hip and then expand to the knee, or do you kind of move chunk by chunk?
I'll continue to work on the hip because what can happen is if I go, okay, I fixed the hip pain, now I'm just going to focus on the knee. If I'm not fixing the knee in one treatment, then next time the patient comes in, they go, oh, my hip hurts again. Can we focus on that instead of the knee? The hip really hurts and so we've got to continue with like back, hip, knee type thing. We've got to continue to make sure that so we might focus more on the knee and not as much on the hip, but we're still going to have a couple of needles in the hip just to make sure that it doesn't flare back up and then we have to start back from the hip to work back to the knee type thing.
Right? It was a journey to hurt ourselves often, so it's a journey to get out of it, right?
It is.
While we have 5, 6 minutes left, for
Sure.
people who might say, this is an area of medicine, that I want to go into, do you teach, how do people get involved in this? What's required to become an acupuncturist?
So it's a master's degree actually, just like any medical doctor. There's a degree involved. It's a 3.5 year degree. So it's a 5 year degree condensed, and in doing so, we tend to do clinicals the same time there's classwork.
Mhm.
I was an instructor. I was a clinical director and program chair for many years, and taught many students. And I'll say it's a tough program, right? In the state of Florida, at least, We have to complete about 4 boards. So we need biomedical, like Western medical boards. We have our our Chinese, Oriental medicine kind of diagnostic boards. Then we have acupuncture. Then we have herbal boards. So there's nonstop boards for us to take to get to where we're at. Each state's a little different, but it's a process. You know, it's a tough education. It's a tough curriculum. But if you're interested and you're passionate, I say go for it because there's nothing more gratifying than helping others.
Sure. Now, Dr. Brandon, you are in Sarasota, Florida. If someone is not in your area, obviously you, at least not yet, we can't send needles through the internet. However, you might be able to get people on their way for something local. So, do you do
Sure.
consultations for people that are not in your area to help get them set up for this?
Yeah, I do. I do. I do kind of like telehealth, teledocs type visits. And I have some that will call in, and we kind of go through what's going on with you now. And it can be a 5 minute consultation. I could say, yeah, the herbs will help with this till you're able to get down here or get to an acupuncturist. Or we could do a whole hour long and go step by step everything. And then herbs actually can get shipped. I can ship them directly to you. There's certain sites that is kind of like an online pharmacy for acupuncturists. So I can write a script for a patient and they can go on and purchase it and have it shipped directly to their door.
We
So
didn't t-
they can start the healing process
we didn't mention
early.
that today, but you have mentioned this on one of our previous shows. So you also look at herbals and herbal medicines as well as various vitamin supplements or whatever. And so there are things that probably some of it maybe works together with the acupuncture, but then also there's things that can also stand alone so people can get a jump start on this. So how
Yeah.
often do you use that?
I use it on almost every patient, depending on what's
Hmm.
going on. I just had one of my long-term patients come in the other day and say I had a blood test and my cholesterol's high. Now, acupuncture, even though it can help with cholesterol, uh, herbs and natural remedies tend to be more effective for cholesterol and reducing cholesterol. So I was able to put the patient on a natural remedy from a company that I trust and really like. And and they start taking that supplement. I've done it in the past, and I've had patients go, "Well, my doctor wanted me on cholesterol meds, and I started taking your stuff, and I never needed that." So there's many different herbal supplements that can stand alone, and then there's many that work in conjunction with the acupuncture for like back pain or neck pain and things of that nature.
All right, well, we have a couple of minutes left. That was something I had meant to ask you. So, if we're using traditional medicines like
Mhm.
now, and then someone like me or whoever wants to come see you, can act like is that something to be mindful of? Like, does acupuncture ever interfere or otherwise interact with more regular medicines, or is it standalone?
It can interact. So it is something that needs to be taken into consideration. That's often why when new patients come to us, we ask what medications or what herbs are you taking? Acupuncture can effectively get it circulating through the body a lot faster, by increasing circulation. So if it's a medication that is a time release something and we put a couple of points in for energy boosting and circulation, that can kickstart that, and next thing you know you're wide awake bouncing off the table type thing. So it's important for us to know these things so that patients can get the treatment they need.
So you could potentially say, all right, maybe take a like after you've consulted with them, take a half dose in the morning or something with me, or maybe don't take any of that stuff for a couple days before you come to me or something.
So generally I say don't stop any medication,
Okay.
and I work around the medication because there's over 400 acupuncture points on the body, and all of them doing something slightly different. I can usually work around that sort of issue without having any issues, any problems with medications. So the more often than not, the big one is blood thinners, and I go, well, you might end up with a bruise. I'm sorry if I catch a little blood vessel or something like that, but other than that, it's nothing to worry about. I don't try and quicken the blood or move blood a little bit faster throughout the body, so it's not too big of a deal.
It's fascinating. Work around a medication that is flowing through our entire body. You can still work around it.
Yeah, yeah. Oh, yeah, that's the key, everything synergistically working together.
Amazing. Dr. Brandon Fuller, always fascinating to talk with you. Before we go, tell everybody where and how they can find you.
So they can either go on the website, which is absolute-acupuncture.com, or they can call or text, and it's area code 941 500-2767.
Absolute-acupuncture.com. Here's what I found. Dr. Brandon Fuller,
Yep.
with thank you very much for being on the show today. I think Alexa or somebody decided to crash our party there
Yeah,
for a hot second.
she was. Yeah.
Always a pleasure. I want to wish you a happy new year, everybody. Dr. Brandon Fuller, Absolute Acupuncture and Stress Relief. Again, one more time, it's absolute-acupuncture.com. I'll give you the final word. Anything you want to say to everybody here in 2023?
Happy New Year, everybody. I hope it's a wonderful, wonderful new year and everybody's successful and has a great time.
And happy new year to all of you as well. From me, I am Ross Morasso. Dr. Brandon, a pleasure as always. Until next time, everybody.
Pleasure.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.